And we are recording. There we go. So hi, everybody. Jerry Blackburn with Influence.
Hi, Jerry.
How are you?
I'm great, Jerry. How are you doing today?
I'm good. I love your background. We were just talking about it offline, and it's so cool because it's right down the street.
It's not a real picture outside today.
No. So we had the opportunity to spend some time, and we're very grateful for the time that Issaquah Mayor Pauly has allotted for us to just catch up about behavioral health stuff in our community. And first of all, we wanted to thank you. We didn't have a chance, obviously, to come in person to the City Council meeting on the 5th, to thank you for the proclamation of Substance Abuse Prevention Month. October is Substance Abuse Prevention Month, and we've been doing lots of stuff in our community. So thank you from all of us at Influence of Choice. And later on, towards the end of the month, you're also going to visit our Youth Advisory Board Tech. And I know they want to thank you, and it's just a great opportunity. So thank you for that. We appreciate your time. It means a lot. Yeah. And so our city has been so gracious in terms of recognizing behavioral health struggles in our community and advocating. And so, yeah, getting the opportunity to talk about that a little bit. I just saw, we didn't get a chance to talk about it offline, but I posted an article today from the Journal of the American Medical Association that alcohol sales have increased in our communities by 54%. And so when you think about our current COVID struggle and what the behavioral health needs are going to be in the future, you know, we're still in the acute phase of putting Band-Aids on things. And so, yeah, wanted to get your take a little bit on that and, you know, kind of see where the conversation takes us as far as potential needs in the community.
Yeah, I think the news in that article sadly sounds very, very true. Since we are now way longer in the early phases of the pandemic than we thought we would be, people's lives have a lot less structure and a lot more stresses. And so we are just not as connected as a community and a neighborhood and as even just school classes as we used to be. So we really don't know what's going on. We don't know what we don't know yet.
Yeah.
I think looking forward at, you know, the next few months, we have to focus as a community on what might be happening that we're not aware of. So you and I have talked before about where we can collect data on different services and needs, rental assistance and food security is one, but mental and behavioral health, much harder, especially when the normal contact points of being in school and having a teacher and a guidance counselor and all of that are just not available right now.
Yep.
So I think I'm really optimistic and hopeful that we'll be able to do a better assessment of need when kids are back in school, even if they're just back for a couple of days. So really looking forward to reconnecting them with their teachers and with their counselors and taking a step back. I know I had a couple of students working on my campaign a few years ago, and I was absolutely shocked at how stressed out they were about life and school and all of that. And now we're in a completely different world with pandemic and economic struggles and societal upheaval about Black Lives Matter. And we don't really have a good touch point or connection with the students right now.
Absolutely. There are a lot of objects in the air that we're unaware of, and the impacts and looking at what is going to look long-term is really difficult, you know, for the young people who were struggling within our school systems because of social anxiety. They're much more comfortable, and now they're engaging this new platform of learning, whereas the more social individuals might be very uncomfortable. You know, overall, you know, as an organization like Influence of Choice, we're aware that young people aren't capable of developing the same resilient skills, or it's a demonstration of the skill sets that they haven't developed in terms of dealing with adversity and it's, you know, kind of coming through and navigating those systems, which is different than becoming paralyzed by them. And so, you know, the social emotional learning curriculum that schools have adopted and our focus on resilient skills, you know, serves us well in terms of community outputs and young people being safer and capable of making healthy decisions. we've had lots of conversations about the benefits of prevention in our community. The reductions in the judicial justice system burdensomeness, the emergency healthcare services are reduced significantly. Community productivity is increased. School productivity is increased. I mean, the benefits to prevention, it's, people hear me say it all the time, but it's the most cost-effective, productive method of engaging our young people that we know of. And unfortunately, in economic struggles, communities often look to that funding as something to put on the back burner and opt to engage acute care, which we always need. Like, we need to feed people, we need to, but when prevention dollars are reduced, we're just kind of moving that, kicking the can down the road a little bit.
We are.
Yeah. And so thank you for your commitment to, the services that we need in our community to continue to prop young people up, because it's such an important part of the work that we're doing. A couple of events that we have that I've shared with your staff. On October 28th, we have an event coming up where we'll explore the continuum of substance use, from experimental use all the way to substance use disorders. So primary prevention as an alternative, all the way up to intervention, so we can get people the care that they deserve in terms of their struggles. And our community has had, unfortunately, extreme losses in terms of fatal overdoses to opiates, and this event will actually feature a couple of the parents in our community who have had that loss, and they're going to share their thoughts and really help, hopefully, parents understand that this can happen to anybody, and that doing the things that we need to do as a community really help dissuade those horrendous outcomes. And so we'll look at some practical application stuff. And we also have some youth leadership conferences that we'll share with the city so that they can share in their community, but they're designed to engage young people in opportunities to develop those internal skills, right? The internal validation skills they need so that they feel good about themselves without things around them, right? So that they're capable of doing the things that they need to do in their community and stuff. And, so yeah, we're super excited about those, and people can visit our website or our social media platforms to take advantage of those opportunities. Anything that Influence the Choice can do for the city, a lot of our dollars go specifically to substance use disorder prevention. So we've actually kind of donated our time, like, to the Issaquah Food and Clothing Bank, because we can't use our dollars for things that are outside our scope a little bit.
Right.
But yeah, is there anything that's that you're seeing as far as community needs that we might be able to help out with?
Yeah, Jerry, thank you for that question. There's a couple of things going on. I did present the City Council with the annual proposed budget about a week or so ago, and they're going to start talking about it this week. The approach that we took in forming the budget was to look at more of diversifying our public safety dollars, so that we are going to try and retool ourselves to be slightly different than we were before. I'm proposing to add 2 human services positions, one in our police department and one in our Parks and Community department, Parks and Community Services department, because we're seeing such a great need. So we currently only have 1 staff person working, and if the council approves my budget, we'll have 3. We also asked council to, and they did adopt it last week, approve funding a position over at the Issaquah Food and Clothing Bank, sort of a navigator type position. We were proposing to start funding that January 1st, but we actually are using some of our CARES Act dollars to fund it sooner, because as you and I talked earlier, we don't have numbers yet to really understand how our community is doing, but we at least have the sense to know that it's not as good as it used to be, and that we're going to need more resources. So council approved that last week, and we're really excited about that. That means we get that resource in place over at the food bank faster. So it's really, this year, the pandemic, the economy, all that has really impacted the way the budget was put together. While we have fewer resources and fewer staff, we're reallocating them so that we have a little bit of an additional focus on human services right now. And actually, the way we can help you, Jerry, is we appreciate all the work that you're doing. And we love to use any of the tools that we have in social media to just echo your message out there, get people to participate in the events, +1, all the stuff that you're doing. So anything that you pass our way, we're more than happy to promote as well.
Oh, we so appreciate that. Absolutely appreciate that. We've had the luxury of being able to adapt pretty rapidly to our kind of virtual world and engage young people. So we will be doing our 9th annual video contest. We'll be doing all of our youth leadership conferences and trying to engage young people in the spring. Keep your eye out. We're going to do a virtual fun run.
Awesome.
Kind of get some young folks out in the community running around, and our staff and our board is super excited about that. So yeah, we'll definitely share those things with you. And thank you again for sharing some time with us. We know you're busy and we appreciate it.
Well, thank you for having me today, Jerry.
Absolutely.